very deserving candidates today with the designation of Master in Hospital Medicine. The Master in Hospital Medicine designation was introduced in 2010. The MHM designation is reserved for hospitalists who have uniquely distinguished themselves in the specialty through the excellence and significance of their contributions to hospital medicine and healthcare as a whole. Today we will induct 3 new Masters in Hospital Medicine. This year's 3 new Masters will join 18 other MHMs for a total of 21 Masters in Hospital Medicine. This is truly the Hall of Fame for the Society of Hospital Medicine. Our first inductee I'd like to invite to the stage, Tina Budnitz. Tina Budnitz has been elected a Master in Hospital Medicine in honor of her leadership in advancing the hospital medicine movement and the Society of Hospital Medicine. Ms. Budnitz graduated with a Master's of Public Health from Emory University's Rollins School of Public Health and a Bachelor of Science from the University of Maryland. Tina joined the National Association of Inpatient Physicians, as SHM was then known, in 2002. She has made contributions to SHM and the specialty of hospital medicine through leading the development of the core competencies for hospital medicine to define the skills of the practicing hospitalist. She coordinated SHM's national efforts to improve discharge planning and launched Project Boost, the Better Outcomes Through Optimizing Safe Transitions, a mentored implementation program that was awarded the 2012 John M. Eisenberg Patient Safety and Quality Award. Additionally, she was one of the architects of SHM's Leadership Academy and Certificate of Leadership program designed to build the hospitalist and healthcare leaders of tomorrow. Last year, Tina helped SHM's Communication Department develop the SHM Communications Roadmap for Success, a strategic communications plan for the organization that aims to keep SHM at the forefront of the hospitalist movement into the next decade. SHM is proud to introduce Tina Budnitz as a Master in Hospital Medicine. Our next inductee is Dr. Greg Maynard. I'd invite Greg to come to the stage. Anybody seen Greg? All right, our next inductee will be Dr. Eric Howell. I'd like Dr. Eric Howell to come to the stage. Dr. Eric Howell has been elected a Master in Hospital Medicine in honor of his foundational leadership in the hospital medicine movement and the Society of Hospital Medicine. Dr. Howell is an Associate Professor of Medicine in the Department of Medicine at the Johns Hopkins University. He holds multiple titles within the Johns Hopkins medical institutions, including Chief of the Division of Hospital Medicine at Johns Hopkins Bayview, Section Chief of Hospital Medicine for Johns Hopkins Community Physicians, and the Chief Medical Officer of Operations at Johns Hopkins Bayview. Dr. Howell joined the Hopkins Bayview Hospitalist Program in 2000, began the Howard County General Hospitalist Program in 2010, and now oversees more than 200 physicians and clinical staff providing patient care in 3 different hospitals. Dr. Howell received his electrical engineering degree from the University of Maryland, which has been an instrumental piece of his background for managing and implementing change in the hospital. His research has focused on the relationship between the emergency department and the medicine floors, improving communications, throughput, and patient outcomes, and moving the specialty forward. Most importantly, his dedication and innovation creates a path forward for thousands of other hospitalists, guiding them to achieve the very best for their hospitals, their patients, and their communities. Dr. Howell is the past president of the Society of Hospital Medicine in 2013, the course director for the SHM Leadership Academies, and most recently appointed as the senior physician advisor to the SHM Center for Hospital Innovation and Improvement, the Society's arm that conducts quality improvement programs for hospitalist teams. He has mentored numerous hospitalists and hospital medicine programs in more than 6 countries and is widely recognized for his work in implementation science. SHM is proud to introduce Dr. Eric Howell as a Master in Hospital Medicine. He was always known for making an entrance. Would like to invite Dr. Greg Maynard to the stage. Dr. Greg Maynard has been elected a Master in Hospital Medicine in honor of his leadership in local, regional, and national quality improvement efforts, including his role in the Society of Hospital Medicine programs. Dr. Maynard assumed a new role as Chief Quality Officer at UC Davis Medical Center in Sacramento, California in March of 2015. He's responsible for championing and coordinating all clinical, quality, and patient safety efforts for the 619-bed academic center and affiliated practices. Prior to that, Dr. Maynard was at UC San Diego for 12 years, where he was a QI leader, chair of the Patient Safety Committee, founding chief of the Hospital Medicine Division. Dr. Maynard was a longtime member of the SHM Hospital Quality and Patient Safety Committee, a frequent leader and participant in the SHM Quality Pre-Course, and was involved in the creation and leadership of SHM's mentored implementation programs in Project Boost, glycemic control, and VTE prevention. He's the chief architect of the SHM glucometrics reporting and benchmarking tools, now used by more than 100 hospitals. Dr. Maynard is published and nationally recognized in all of these areas, making significant contributions to the medical and hospitalist community. And from July 2011 to February 2015, he served as a senior vice president of SHM in the Center for Hospital Innovation and Improvement, providing oversight and leadership for a variety of other SHM education and QI projects. SHM is proud to introduce Dr. Greg Maynard as a Master in Hospital Medicine. We now turn to our Awards of Excellence. SHM's Awards of Excellence honor the very best hospitalists in the hospital medicine movement, those individuals who have committed themselves to truly providing the best possible care to hospitalized patients and moving the specialty forward. More importantly, their dedication and innovation create a path forward for thousands of other hospitalists, guiding and empowering them to achieve the very best for their hospitals, their patients, and their communities. As with many accomplishments in hospital medicine, these honors are rarely earned alone. I hope you will join me in acknowledging the contributions of the colleagues, family members, and loved ones of today's honorees. We are taking award submissions for 2017 now. Please visit the SHM booth or go to www.hospitalmedicine.org/awards for more information. The first award is for outstanding service in hospital medicine. Dr. Thomas McElraith is the chairman of the Hospital Medicine Department at Mercy Medical Group in Sacramento, California. Dr. McElraith improved patient flow between admissions and rounding with a novel operation system called Central Coordination, and it is now the standard for the Dignity Health facilities in Sacramento. The system markedly improved ED response, on-call hospitalist stress, and patient continuity. He has led many other quality and operational improvements, including unit-based rounding, rapid response team development, and restructured staffing to improve physician coverage. Dr. McElraith is on the Hospitalist Advisory Board at the Doctors Company and most recently became a leader in the patient experience movement by developing the cognitive emotional disconnect model for understanding patient experience in hospital medicine. He is currently a member of the SHM Practice Management Committee. Lastly, Dr. McElraith has earned a certificate of leadership in hospital medicine from SHM. Please join me in congratulating Dr. Thomas McElraith for his excellence in outstanding service to hospital medicine. Our second award is for excellence in research. Dr. Vineet Chopra is an assistant professor of medicine and a research scientist in the Patient Safety Enhancement Program at the University of Michigan and Ann Arbor VA Medical Center. Dr. Chopra's research efforts are centered on improving the safety of hospitalized patients by preventing hospital-acquired complications. Using peripherally inserted central catheters, PICCs, as a model for this inquiry, his work is focused on quantifying current use of PICCs in hospitalized patients, estimating the risks of complications, and defining innovative ways to improve decision-making for these devices. His research has been cited 1,962 times, 1,580 times since 2010. He is an associate editor for the American Journal of Medicine and the Journal of Hospital Medicine, and will serve as chair for SHM's Research Committee in 2016. Please join me in congratulating Dr. Vineet Chopra for his excellence in research. The award for clinical excellence goes to Dr. Mark Tolke. In 1998, Dr. Mark Tolke became the first hospitalist at Barnes Jewish Hospital and helped to form the Hospital Medicine Division of the Washington University School of Medicine in 2000, one of the first divisions in the U.S. The division has grown to 70 physicians and 8 nurse practitioners and consistently turns in superior performances on clinical outcomes as measured by United Healthcare. The division has led the way with innovations in care models and teaching models and was one of the first to offer a sub-internship experience on the non-teaching service and one of the first to offer co-management with their oncology service in 2002. Dr. Tolke still spends 2/3 of his time on clinical services and states that his job satisfaction comes largely from patient care and teaching. Please join me in congratulating Dr. Mark Tolke for his work to promote clinical excellence in hospital medicine. The SHM Award for Excellence in Teaching is presented to Dr. Alberto Puig. Dr. Alberto Puig has spent his career fully devoted to medical and clinical education and is currently an associate professor of medicine at the Harvard Medical School and the director of the core educator faculty in the Department of Medicine at Massachusetts General Hospital, where he leads a unique group of physician teachers fully devoted to clinical education. He is a regular discussant on educational programs for the Academy at Harvard Medical School, and his contributions to medical education and clinical hospital teaching have made him a celebrated teacher and educator. Dr. Puig has played an important role at SHM and in the field of hospital medicine through his efforts as a medical educator, and he is an avid student of the history of medicine and has been a frequent presenter at the annual SHM meeting on this topic. Please join me in congratulating Dr. Alberto Puig for his excellence in teaching. The Excellence in Hospital Medicine for Non-Physicians Award is presented to Tiffany Panic. Tiffany Panic is currently the Hospitalist Administrator for the Johns Hopkins Division of Hospital Medicine at the Bayview Medical Center in Baltimore, Maryland. She's a Senior Fellow in Hospital Medicine and has also received her Certificate of Leadership in Hospital Medicine from SHM. She has been at Johns Hopkins for more than 12 years and has been instrumental in the significant growth and success of the Division of Hospital Medicine. Within SHM, she's been a member of the Practice Administrators Committee for 3 years and was recently elected to a 2-year term as the Vice President of SHM's Maryland chapter. She's the first administrator to be elected to chapter leadership, to receive the Certificate of Leadership in Hospital Medicine, and to have an abstract accepted at an SHM annual meeting. Please join me in congratulating Tiffany Panic as the 2016 winner of the Award of Excellence in Hospital Medicine for Non-Physicians. The SHM Award for Excellence in Humanitarian Service goes to Dr. B.J. Acharya. Dr. Acharya works as a hospitalist at Massachusetts General Hospital and is currently completing the Harvard Medical School CRICO Fellowship in Patient Safety and Quality. His humanitarian work started from the time he was in medical school, where he led many health camps in extremely poor villages, ran blood donation drives, and established the Poor Patient Fund. After graduation, Dr. Acharya, with his friends, worked to establish a nonprofit clinic named the Nyaya Health, now possible to serve the healthcare needs of a very remote district in rural Nepal. Prior to the clinic, there was no physician for more than 250,000 people. Recently, after the massive earthquake in Nepal, Dr. Acharya led the relief efforts for the earthquake victims with the MGH Global Disaster Response Team and the American Nepal Medical Foundation by providing clinical care and rebuilding health centers in affected areas. Dr. Acharya strongly believes in the capacity of hospitalists to be strong advocates for their patients, peers, and communities, both local and global. Please join me in congratulating Dr. B.J. Acharya for his excellence in humanitarian service. The SHM Team Award in Quality Improvement is presented to the WellSpan Health Active Bed Management Team. Inspired by a pre-course regarding active bed management, or ABM, at Hospital Medicine 2012, Drs. Mary Ellen Pfeiffer, physician lead for the ABM at WellSpan, and William Tex Landis, WellSpan Hospitalists Medical Director, returned to Pennsylvania and began brainstorming. After a site visit to Hopkins Bayview, a team of hospitalists collaborated with WellSpan Nursing, Benita Trapnell, RN, Patient Logistics, Mark Mione, RN, Case Management, Jessica Hagan, RN, and the Emergency Department, David Vega, Brian Yetter, to pilot and implement ABM within WellSpan's York and Gettysburg hospitals. Ultimately, ABM at WellSpan has maintained the fastest time to admission order entry for any service at York Hospital, a decrease from 80 down to 10 minutes, with less variation for 2 years. ABM has also sustained national benchmark ED length of stay when the hospital is functioning at general capacity. ABM also became instrumental in process and outcome objectives from a number of other hospital-wide initiatives, including structured interdisciplinary bedside rounds on all medical units in York and Gettysburg hospitals. The success of ABM and SIBR, SIBR, allowed a transition of care project to focus on efficient discharges. Furthermore, Dr. Pfeiffer led a direct admission task force to improve direct admission referrals, safety, and acceptance, the number of which has since doubled. Without ongoing hospitalist ABM leadership, these significant improvements would not have been possible or sustained. Please join me in congratulating the WellSpan Health Active Bed Management Team for their excellence in quality improvement as a team. Junior Investigator Award is presented to Dr. Robert Burke. SHM's Research Committee recognizes an early career hospitalist researcher who is leading their way in the field. Dr. Robert Burke is the Assistant Chief of Hospital Medicine at the Denver VA and an Assistant Professor of Medicine at the University of Colorado. He has been funded through a VA Career Development Award and an NIH GEMSTAR Award to improve transitions of older adults from the hospital to post-acute care facilities, such as skilled nursing facilities. Dr. Burke is also active in quality improvement work, serving as the primary mentor for the Chief Residency in Quality Improvement at the Denver VA and as an associate editor at BMJ Quality and Safety. This year, the committee is pleased to present the HM16 Junior Investigator Award to Dr. Robert Burke for leading the way in hospital medicine research. Please join me in giving all of our award recipients this year a big round of applause. Speaking of the future of hospital medicine, SHM is proud to acknowledge the first ever winners of its new Student Hospitalist Scholarship Program. In June of 2015, 3 medical students were awarded scholarship grants to complete scholarly work with an active SHM mentor in a project related to patient safety, quality improvement, or other areas relevant to the field of hospital medicine. At this time, we would like to acknowledge the 2015 Student Hospitalist Scholarship Grant recipients. Dr. Frank Zadrovich from the University of Illinois at Chicago, A Burden Without Benefit, the predictive accuracy of inpatient telemetry alarms forward patient outcomes. If Frank would please stand. Dr. Miriam Zander, the Toro College of Osteopathic Medicine, for a systematic review of physiologic monitor alarm characteristics and pragmatic interventions to reduce alarm frequency. If Dr. Miriam Zander would please stand. And finally, Monica Shaw from Wayne State University School of Medicine for quantifying post-hospital syndrome, sleeping longer and physically stronger. Monica, I understand, is not with us today, but please join me in giving all of the award recipients a round of applause. At this point, I'm going to transition to Dr. Larry Wellickson, our CEO, for acknowledgement of past presidents and the current board members.
Good morning, and thank you very much, Bob. We're just going to take a minute, to acknowledge our current board and our past presidents. You know, one of the really great things about this job for me is the people that I get to work with and that you have chosen to lead your society. The board works year-round to drive the innovation and the growth of this large specialty, and I think that that they are the engine behind SHM. So I'm going to. I know it's very hard in a large room for you to see them, but I'm going to have them stand down in the front, and I want to acknowledge obviously Bob Harrington, who's our outgoing president, Brian Hart, who's our incoming president, Burke Keeley, who's our immediate past president, as also Erin Stuckey-Fisher, Nassim Afsar, Howard Epstein, Chris Frost, Jeff Glasheen, Ron Greeno, Danielle Schur, and Bradley Sharp, and our most recently elected and first nurse practitioner on the board, Tracy Carden. Please stand, and why don't we acknowledge their contribution. I also want to take a moment to just acknowledge the people that we've now been around long enough that we have had a long and growing list of past presidents. We won't parade them all up on the stage, but I just wanted to call out their names and acknowledge their contribution. As you saw yesterday when we had the three original presidents, that this was a journey without a roadmap, and it takes innovation and confidence and curiosity to get us where we are. So I just wanted to acknowledge the past presidents that include Win Whitcomb, Bob Wachter, John Nelson, Ron Angus, Mark Williams, Jeff Dichter, Gene Huddleston, Steve Panelat, Mary Jo Gorman, Rusty Holman, Pat Cawley, Scott Flanders, Jeff Weiss, Joe Lee, Sean Frost, and Eric Howe. Let's give them all a round of applause. And then I'd like to take a moment, I'd like to call Burke Keeley up to the stage. Burke really does not enjoy having people say nice things about him, so that's why I'm going to bring him up here so you can see how uncomfortable he is, all right? Burke has been on the board for the last 7 years. Before that, he had been chairman of our benchmarks committee and oversaw our survey on the state of a hospital medicine. Burke is currently working at Health Partners in Minnesota, where he's the senior medical director of hospital specialties, which oversees not just hospital medicine, but emergency medicine, critical care, cardiology, and inpatient psychiatry. And it has taken a career path that is not too different than most people who arrive on the SHM board, where they start out as a practicing hospitalist and then their scope just expands. But I think one thing that's been true in Burke's entire time at SHM and on the board is he has been a clear and articulate voice for the practicing clinical hospitalist in the community setting. And I said at the board meeting that when you look at the value of his contribution by the number of words divided by the impact, it has been just monumental. When Burke says something, everybody turns and listens because it's really, really important. One of the other great things about SHM is that when people matriculate off the board, they've been on the board and they become a past president, that when they're as valuable as Burke, that we continue to find a way to use their talents. And I expect that Burke, like many of our past presidents, will be intimately involved in SHM. So this isn't goodbye as much as this is sort of like a graduation from one part of our society to another. On a personal level, as you might imagine as the CEO, that the linkage between me and the president is very tight. We spend a lot of time together. We are trying to make this up on the fly as we go along, and it requires a lot of trust. And I can tell you that I've enjoyed every moment working with Burke all along the way. It's been a real pleasure for me, more than a job. So with that, I just wanted to have everybody here give Burke a round of applause and thank him very much for his service to SHM. So of course everybody gets a plaque, but one of the good things that I try to give a personal gift to the president when they're leaving. Those of you who were here last year remember that we dragged up a 10-foot surfboard on the stage for Eric Howe. He still has it. He's not usually standing on it, he's usually in the water. But for Burke, I wanted him to get an iWatch, so we're giving him an iWatch. So thank you very much. All right, moving right along, I'm going to call Bob Harrington back to the stage. Bob, once again, I think I got to say some very nice things about him yesterday before he introduced the Surgeon General. Bob is another real doctor that's been on the SHM board. As I said, he first family medicine trained hospitalist to run the board. He's been a leader nationally in the post-acute care movement. And like I said, we went to the #1 medical school in the country, Temple University in Philadelphia. And I want to welcome Bob back to the stage to say a few things to you about the state of hospital medicine. So, Bob.
You never know what you're going to get with Larry. He likes to keep it interesting. Well, thank you. Thank you for being here at HM 16. What a great meeting. What a tremendous turnout. Each year as I come to this meeting, I'm more impressed and amazed at the tremendous growth of this organization and our specialty. And I really think it's truly a testament to all of you, to the great work that you're doing, and how quickly that message spreads to others who are interested in carrying on and improving the quality of the care we provide for our patients. Thank you all for doing that. And thank you for allowing me to serve as your president for the last year. It's truly been an honor and a privilege. This year's been really a rush. I know I sound somewhat like my teenage children when I say that, but as I reflected on the year in preparation for this talk, my overwhelming thought was that life seems to be moving very fast. It seems like only yesterday that I was standing in front of you in Washington, D.C., kicking off my term. It's been a really busy year, and things always move fast when you're busy. But as I think about how fast things are moving, I don't think it's just me. I think there's plenty of evidence all around us in all of our lives that the pace of our world is quickening, especially in healthcare, and we, in response, are moving with it. I would like to think, though, that I did slow down at certain points over the past year, at least enough to enjoy it. And truly, the most enjoyable part for me has been the opportunity that I have been given to be able to meet many of you through conferences, projects, and even spontaneous introductions. We are a membership organization, and I was given a firsthand look over the last year at those who are the engine behind this organization's momentum. SHM has always given me more than I have given it, and this year was absolutely no exception. I would be remiss if I didn't take a few minutes to call out some of the milestones, achievements, and challenges that we have passed or soon will pass in this fast lane of life that we currently occupy. And I do this both to recap the year, but also to point out what a bright future we as an organization have. As you all know, this year we celebrate the Year of the Hospitalist, 20 years as a specialty. Coincidentally, we are also about to welcome our 15,000th member, which we did yesterday. And in addition, just this past week, CMS approved a long overdue specialty code for hospital medicine, giving us the newfound ability to track and compare important data as it relates to our specialty and clearly separate the work that we do from that of our primary care colleagues. Thank you to the hardworking Public Policy Committee for all of their efforts on this very important initiative. I enjoyed the opening plenary yesterday listening to the panel discuss the early years and gaining perspective into how truly visionary they were and how far we have come as a specialty since then. It made me realize that we really have passed through our infancy, our childhood, and our adolescence as an organization and are now entering young adulthood. And we're starting to wrestle with a lot of the issues that young adults normally wrestle with. Questions like, what do we want our identity to be? And maybe even more importantly, who does our world need us to be? How can we continue to grow and impact that world, both internally through our organization and through partnerships that we may develop? Very thankfully, we have a solid foundation on the bedrock of what is right for our patients: quality, efficiency, and the patient experience. And I think these guiding principles have shaped the way we have begun to answer these existential questions and have set us on the right path. In respect to our identity, we've had a very busy year on the front of continuing to define our specialty, especially at the edges of our training and in places where we interface with other specialties that are essential to our mission. Specialties like critical care, surgery, palliative care, and post-acute care. In September, we convened a strategic board meeting inviting key SHM members to our corporate offices in Philly to explore all of these interfaces. We particularly looked at where our traditional training left gaps in our knowledge, skills, and attitudes, and more importantly, how our organization can begin to address some of these gaps. We've begun the process of developing tools and partnerships to address the gaps, and our members will see a wealth of resources over the next few years that will allow us to practice more confidently, especially at the edges of our scope. We have also built on previous relationships and in some cases begun new relationships with the organizations representing other specialties and potential partners in some of these realms. We've become engaged in the perioperative surgical home initiative, looking for ways to partner with our surgical and anesthesia colleagues to provide higher quality and higher value care for our surgical patients. We've had ongoing dialogue with our critical care colleagues in an effort to improve access to basic, high-quality ICU care, especially in areas where intensivists are scarce and the responsibility for these patients falls on hospitalists. We are discussing ways to bring enhanced palliative care skills to the non-fellowship trained hospitalists, and we have seen more and more of our membership engaged in care outside the hospital, becoming increasingly responsible for the episode of care. As a result, we are committed to dedicate more resources to transitional and post-acute care. We continue to produce resources for our members that help define who we are. The State of Hospital Medicine Survey deadline for responses has been extended until the 18th, and I'd encourage any and all of you who have not responded yet to take part in that study. Our responses allow us to understand and represent the true state of hospital medicine across our country. SHM clearly realizes it plays a pivotal role in defining our specialty in an ever-changing healthcare environment. But, and maybe more importantly, we also realize that we need to be a home for resources that will allow us as hospitalists to safely and effectively practice in this changing world. Part of our response includes the development of an increasing array of educational products. We developed and released Spark this past year and are planning a late 2016 release of Spark 2 to expand the content from what is currently hospital medicine specific to a more broad MOC prep tool. In addition, we've been front and center in advocating for our members as the MOC process is being redesigned to become more relevant and more closely linked to our daily clinical practice. We've seen the winds of reimbursement change blow for a few years now. But over the last year, the winds have become stronger and more consistently blowing in the direction of shared risk. Initiatives like BPCI and the mandatory CCJR program and the massive growth of Medicare Advantage have pushed us to change the way we practice. We're faced with either expanding our scope or partnering with others who are similarly aligned and potentially better equipped to provide specific services throughout the continuum. I believe the collaborative nature of our organization has positioned us uniquely to drive success in these evolving new alternative payment methodologies. In addition, we continue to be a force in regulatory and the legislative realm. Our influence is far out of proportion to our relative size because of our alignment with the triple aim: improving health, controlling cost, and enhancing the patient experience. Our advocacy and public policy efforts have been substantial, well-received, and we continue to get invited back to be part of the legislative advisory team. I am inherently confident that SHM will continue to impact the healthcare system of the future. All of this has really resulted in an adapt and overcome philosophy from our staff and from our board. We've made significant internal changes to the organization in an attempt not only to keep pace, but to truly stay ahead of our rapidly changing world. The single largest organization-wide project we've undertaken over the past year has been to redefine our communication strategy. This started as our communication roadmap to success early last year and has become an initiative that will enhance our ability to communicate with our membership, both members and non-members alike. One that will better distribute all of our publications, including the award-winning content of our journal and The Hospitalist. Our strategy will enable enhanced cross-linking and indexing of all of our content, allowing members to search for and find information more quickly. It will allow us to be device agnostic, displaying information on any platform, phone, tablet, desktop, or laptop. The roadmap has expanded our social media presence and abilities and will allow us to engage anyone interested in our message in a way that is personal to them and meets them where they are. We've tapped into every facet of our organization to develop the strategy because we realize that our ability to engage our members, you, in a meaningful, personal way is central to our ability to grow over the course of the next few years. I would like to say a few thanks before I conclude. First, to my wife, Chris, and my family, who have supported me over the past year with love and encouragement. I know it's not been easy. I love and appreciate you for allowing me to take this on. Second, I'd like to thank Larry Wellickson for his unwavering leadership to our organization over the last 17 years. I've had the privilege of seeing the full scope of his impact over the course of the last year, and it truly is impressive. Third, my board of directors. It has truly been an honor to work with you and alongside you over the last year, and I'm grateful for your dedication to our organization. Last, and certainly not least, the incredible rock star-filled SHM staff for their tireless work and dedication. Thank you for putting together this incredible meeting and all that you do to advance our mission. For those of you who attended last year's meeting, I ended my address with a slide that simply said, "Who better than hospitalists to lead the way?" In a world that's moving as fast as we are now, I truly believe that now more than ever. Our challenge will not be to keep pace with the world, but rather to continue to stay out in front and remain leaders. Nobody in healthcare knows what we know. Nobody is committed like we are committed, and nobody is better positioned to drive positive change. I'd seen this quote a few years back from an eccentric early American writer, and I thought it was particularly appropriate for this talk. The world is moving so fast these days that the man who says it can't be done is usually interrupted by someone doing it. I wish each of you in the audience today could see this room from my perspective. 4,000 committed, energetic, exceedingly bright people looking back at me, all brought together by a common bond, a desire to improve healthcare in a way that has never been done before. Improvement in the realm of cost, quality, and patient experience. Improvement in a way that will change our country's healthcare system for the future. All of us perfectly poised to interrupt the man who says it can't be done. Thank you. At this point, I'm going to ask Larry Wellickson to come back up to the stage for the CEO remarks.
Thank you very much, Bob. I'm going to be relatively brief today. It's even brief in Larry Wellickson terms. Let me just say that I get asked all the time, what's the secret sauce that makes SHM so incredible? I get to sit on the Council of Medical Subspecialties CEO group, which is the CEOs of the American College of Surgeons, American College of Physicians, American Academy of Pediatrics and such. And nobody has an organization like this. We're young, we're energetic, we're doing things, we're growing. It's pretty cool. In a world where everybody else is talking about burnout and, leaving the ship, we're adding people left and right. And the secret sauce is pretty simple. We have created a culture in which incredibly talented people thousands of incredibly talented hospitalists. You've seen some of them in the award winners today and in the new fellows and certainly in the masters. But we have opened up the tent, opened up the doors, and people like you come in and you say to us, I have talent, how can I be helpful? And we create sort of a synergy and a coenzyme, and the results are SHM and hospital medicine. And it's really an incredible kind of formula to get things done in an evolving world. I want to just take you on a journey from 1996 to 2016. This is especially that's 20 years in the making. I hope that many of you have tweeted at SHM Powered, hashtag SHM Powered along the way here. And I just wanted to show you some statistics. When I showed up here 17 years ago, we had about 200 people at our annual meeting. We now have 4,000. We had about 100 members or so, and we now have 15,000. And there were a couple of hundred hospitalists. Really, nobody knew how many hospitalists there were. And somebody could be working 25% of their time in the hospital and call themselves a hospitalist at a time. And now, according to the American Hospital Association, there's 52,000. It is an incredible, other than the adoption of smartphones or the number of people that are on Tumblr, there aren't many things that have grown as fast as we have. And we're not done growing. That one of the things, the board has been very kind to offer me 3 more years as CEO, and I plan to help SHM sort of think through some broader things. And one of the places we're thinking about going is that the world needs us. And that, as we heard yesterday at the Special Interest Forum, our International Special Interest Forum, where we had 20 or 30 people that had traveled from around the world to visit us, there is a lot of needs. There's some very big similarities in some places and some clear differences. But we already have more than 100 members outside of North America. We've helped the Canadians form the Canadian Society of Hospital Medicine, but we're looking more broader than North America. And we're planning now to go out and sort of survey the international hospitalists that we can identify to find out what are their needs. How can we be helpful? Is it practice management? Is it performance improvement? Is it organizing? Is it providing leadership training? But we're going to figure this out, and this is just the beginning of this whole new vein in the broad resources of hospital medicine. I think that there's no doubt that we do something that no other professional medical society does. We have a Center for Hospital Innovation and Improvement, and we have raised more than $10 million over the last several years and been active in more than 500 hospitals. No other medical society does anything remotely like this. If people do a registry or set guidelines, they think they've changed the world. But whether it's Boost, that's now been at 235 sites or downloaded almost 10,000 times, or looking at glycemic control, or VTE, or our new project in IPASS, which is around handoffs and transitions, SHM is trying to develop and implement change right at the front lines. And I think that this isn't limited to just those projects, and we're out doing things in fighting the resistance. As you well know, there's a big national project being instrumented and led by the CDC that we're very prominent in, but we're also involved in heart failure and atrial fib and opioids, and the list goes on and on. And as Bob mentioned, we know that even though this year has been a year where when you say the word board certification, you think of riots of doctors saying, don't bug me, leave me alone. And it's interesting that we've had a very different approach to this. I think hospitalists, maybe because we're young, maybe because we've always been measuring other things, that we don't quite have a problem with being accountable to our patients for being professional. I think what we want is a process that at the end of it, it makes us feel like we've become a better doctor, or it reinforces that we are a better doctor. And I think the responsibility of SHM is to provide resources developed by hospitalists for hospitalists that gets to the nitty-gritty of what you need to know. And so we started out by doing a Spark, in which we looked at things that other MOC prep courses weren't looking at, such as palliative care and patient safety and decision-making and perioperative care management and quality, cost, et cetera. And we've been very happy with the way this has been received and utilized. And we're in the process of developing the second version of Spark, which is going to be more of the clinical content, the diseases that you see every day, but looking at developing resources that are specific to what you do every day, rather than some of the tools out there that are much more generic. And then we have felt a need, even though we're excited that 4,000 people get on a plane and come to a physical location, we do recognize that most of your needs for education as the practice of hospital medicine change are best delivered at convenient to you on your devices, at home, at work. And so we have made our online portal free with membership. We have tried to have a variety of hospitalist educational experts deliver content, and we're very gratified to see how well this has been received, and this will be something that will continue to grow. As Bob mentioned, that we just before this meeting, we heard from CMS that we are going to have a specific code, and a lot of the chatter has been, what the heck does this mean? How do you get yourself registered? Well, we're going to start to explain this to you tonight at 5 o'clock in Convention Center Room 16A and B, because we're just learning. This is, when CMS announces something, it doesn't mean that it happens tomorrow. It takes a while, but you will have the opportunity to change your registration with CMS as a hospitalist as opposed to an internist or a family medicine trained physician. And then this is going to be an opportunity to collect data. It will be important as MACRA is further defined. It's going to be important as they have comparisons between what you do and what other hospitalists do. And we're going to get this right. But this is a very declarative thing for hospital medicine as a specialty, to begin to collect data in the huge warehouse that is Medicare. And as Bob started to mention, one of the great things, it may not feel great to you because you're right in on the front lines, but the scope of hospital medicine seems to be very different on Thursday than it was on Monday. And that this went for much more than just replacing traditional internists or traditional family medicine physicians. And this slide attempts to list sort of the things we just take for granted: surgical co-management, doing all the neurology. Not only have neurologists left the building, but endocrinologists have left the building. It appears that people who would have gone into critical care in the past are going into hospital medicine. And what happens is the patients haven't gotten any less sick. And so we are being asked to do more than we were initially trained to do. And this is not going to slow down, because as Bob also alluded to, that our scope is creeping out even further. And that the fastest growing part of hospital medicine is the management of the patient once they leave the hospital, whether they're in a transitional post-acute care or whether we're the ones that are asked to do the first 2 or 3 discharge visits as an outpatient. And we are going to need to extend the palliative care physicians. We have been doing for more than a decade the perioperative care, and we need to partner with our surgeons to do it even better. But we're evolving as we get into bundled payment and alternative payment models, that hospitalists need to be in the center. We need to be providing the leadership. We do not want to be marginalized and become a vendor or a commodity. And SHM will continue to provide leadership to help you get there. So we can sort of see where hospital medicine has been. We can get a look of where it is now. But I can assure you that over the next couple of years, hospital medicine will continue to look very, very different. But we are all, not just the board, not just the staff, but all of you are prepared to help evolve to whatever we're going to be next. And so let me just close. I'm a pretty optimistic. You should get worried if I get up here and give a pessimistic. If I say, woe is me, the end is near, everybody run for the exits. We are still the place everybody else wants to be. Even though we are slowly aging, we are still young. And we still are enthusiastic and optimistic and the envy of all other specialties. And this is why we continue to attract very smart people who want to come in and make this their career. And we have a culture that is perfect for the evolution of healthcare, where most other medical specialties have to stop and attempt to retool a very large and somewhat vulcanized kind of approach to things. We've always been nimble and adaptive, and that's what the world calls for now. And I just want to say on a personal note, I never take for granted any time the opportunity that's been afforded to me personally, the opportunity to work with the board, the opportunity to work with your SHM staff. And as I've had the opportunity to walk around the halls and meet many of you, I'm just absolutely amazed at how incredible our specialty is. So thank you very much for giving me the opportunity. I know my wife is very glad that you take me off her hands, and I look forward to the next 3 years. Thank you very much. You know, and just as, you know, today we had to say goodbye to a true leader in Burke Healy, and you can see that Bob Harrington's time as the president, you know, is coming to the end. But I'm going to tell you, we got a whole closet full of great people to call on. And next year's president, Brian Hart, who's going to come to the stage and say a couple of words, is just another example. Brian started out as a hospitalist, actually worked after he left his residency at UCSF, was a frontline clinical hospitalist in Marin County at Marin General in San Francisco area, and then he went out to the Cleveland Clinic, where he worked as a hospitalist, and he's currently now the president and CEO of Hillcrest Hospital, which is one of the Cleveland Clinic hospitals. And so I want to have you give us a warm welcome and bring Brian Hart to the stage to say a few remarks.
All right. Well, thank you very much, Larry. And really thanks to all of you. I am really excited to be up here this morning. I'm really excited to be representing this organization, all of you, and the board over the next year, and actually join the reflection upon what hospital medicine has become over these last 20 years. And maybe just talk to you for a couple minutes about our paths, the paths we've taken to get here today as an organization and individually, and where our paths forward might lead. I've talked to many of you over the past 2 days, physicians, advanced practice providers, NPs and PAs, residents, students, administrators. And in those conversations over the last 2 days, I've most appreciated two things. One is just the incredible energy of this organization and its membership. And the second is actually the incredible careers that many hospitalists now have. Among us are certainly very passionate clinicians, and also among us are an incredible diversity of roles that go beyond the clinical to maybe an extent that we couldn't have anticipated 10 or 20 years ago. I've met program directors, current and future education and research leaders, but I've also met hospital and health system executives, best-selling authors, insurance executives, chief quality officers, chiefs of staff, policymakers, policy experts, innovators, and many other titles and roles. And hopefully I've even met out there somewhere in the last couple days a future Surgeon General or CMO of Medicare. And in preparing for today, I've had the opportunity to consider my own career path and some of those of my close colleagues, and appreciate that we've had these opportunities because we chose hospital medicine, because we are hospitalists, and our day-to-day experiences provide the leadership incubator that really no other specialty can claim. In fact, I believe there's no other or no better place than hospital medicine to find your path, and no better organization than SHM to help and support each of us in finding and following it. So I'll expound just a little bit on what Larry described. My path so far actually began, conveniently enough, 20 years ago in 1996. I was an intern at UCSF, learning directly from some of the individuals who would become pioneers and leaders in hospital medicine, and who have cast long leadership shadows, influencing a generation of physicians by putting definition and structure around the concept of the hospitalist. That word hadn't really yet quite fully penetrated the national consciousness quite yet, but Bob Wachter and Lee Goldman had already started implementing the model at the Academic Center at UCSF. Yesterday, you heard Bob's perspectives on his first years, but from the line of sight of a lowly intern who is really just trying to figure out how he could make sure he made it to midnight meal on call, we didn't really understand the big picture. But what we saw were that these hospitalists had leadership attributes that distinguished them from other attendings and other physicians. They had an appreciation for the team, a collaborative approach, an ability to communicate across disciplines, and to appreciate the real complexity of coordinating acute care. They were blazing trails by challenging long-held beliefs in the academic setting about how to take care of patients in the hospital. And they led from the front, not from behind the lines. So it's really no wonder that so many of my colleagues gravitated towards this new field, some to academic positions, some, like me initially, not. After residency, my first job, as Larry said, was just across the Golden Gate Bridge at a community hospital in Marin, where a new hospitalist program had just started a year or two earlier, and where my colleagues and I actually first saw this as a durable, career-long specialty. And what we realized was that the same collaborative skills that were creating better patient care with nurses, colleagues, other members of the medical staff, and pharmacists were positively recognized and reinforced. And very early on, we were asked to take on roles in the hospital and on the medical staff for which our only recommendations were our experience and the way we took care of patients. My path then actually turned a couple thousand miles to the east to the Cleveland Clinic after I got married and had my first child, and that brought me back into the academic world for a number of years. After 2 more children, I was then about 8 years in, only 8 years in, clinical practice, and my path began turning in some very frankly bizarre and unexpected ways, initially as a department chair, then as the medical director for data and analytics and population health, and now several roles later as head of a hospital, as Larry mentioned, the Cleveland Clinic Health System. And all of this for me was extremely unexpected and extremely unplanned. And the reason I tell you my story is that it is not at all exceptional. It is not at all extraordinary, because what I've heard these last 2 days are stories of hospitals ascendant in their organizations, being given incredible responsibilities and long rope, and it turns out the day-to-day work that we do as hospitalists has really been the best training possible for all these roles. And that is the story, and will be and can be the story of many of you in the audience, many of you here, and many of those hospitalists yet to come. Because the secret that I think we haven't yet fully appreciated or articulated is that hospital medicine is so full of opportunities to learn and grow and find amazing career paths that we easily outshine every other medical specialty. The practice of hospital medicine puts so many components and challenges of leadership right in our sights on a daily basis. Complex team problem solving, managing relationships up, down, and across an organization, challenges with technology, education, process improvement, ethics, medical staff, and administrative and organizational politics. The successful hospitalist, almost by definition, has to be able to learn and attain mastery across a broad set of leadership skills. We become naturals in a world of matrix management because it's how we get through every day. So is it any wonder then when our medical staffs, our administration, our medical schools come looking for a project leader, a new department chair, a head of patient experience or quality, a leader or an educator, that they come looking for us? Or that hospitalists are now at the highest levels of healthcare policy and being asked to give testimony to Congress? At my organization, which is renowned for its surgical expertise, hospitalists now occupy many of the key leadership roles in residency education, medical school teaching and curriculum. Our patient safety officer, our last 2 patient safety officers actually, have been hospitalists. Our EMR medical directorship, leadership in business intelligence, patient experience, several enterprise-level quality positions, people like me who are regional hospital leaders, CEOs and CMOs, case management directors, are all hospitalists. And I would submit that all of them came to these positions not because they had them as as a clear career destination in mind, but because our practice demands a set of skills to an extent that no other specialty does, and we're being recognized for that every day. There is no better environment to learn about leadership, teaching, and complex systems than perhaps the most complex system of all, the hospital. And for that reason, I firmly believe that hospital medicine is the most fertile soil to grow amazing careers. And that's what I really implore all of you here today to do. To look to hospital medicine to find your own career paths. And on that journey, we must commit that SHM is the organization dedicated to helping you do that, with curriculum, skills, mentorship, so that our leaders are ultimately effective and successful. SHM's path has grown and stretched out in remarkable directions over nearly 20 years as we advance the careers and interests of hospitalists and help make our care systems better for our patients and our communities. As Larry said, we're also a young organization, and within that youthful spirit is a willingness to take risks, ask questions, and do things that other professional organizations simply haven't, won't, or haven't thought of doing. And our work doesn't stop. It's impossible, of course, to see around every corner, but in the coming year and coming years, I believe that SHM and hospitalists have to move forward in at least 4 key directions, some of which you've heard Bob and Larry expound on. The first is that we have to continue expanding and engaging our membership. Yes, we continue to add several thousand new members a year, and yesterday we recognized our 15,000th member, but there are thousands of physicians, nurse practitioners, PAs, administrators, and trainees out there yet in the field of hospital medicine, and that's just in the United States, potentially many more internationally, and they are not yet SHM members under our big tent. We want to draw in those hospitalists and show them how, whether it's through our many educational offerings, the Learning Portal, the Center, QC, AHA, Leadership Academy, or many of the other initiatives that Larry described, and getting them actively involved in projects and committees so that we can engage them at every stage of their career. Second, we must continue pushing our members and projects to be focused and centered around the triple aim, and in particular, the third leg, which is patient and family-centered care or experience of care. I personally have come to believe that everything we do in the hospital setting that takes the step of incorporating the thoughts and perceptions of our patients and families will give us a better result. But in most parts of the healthcare world, we're only scratching the surface on how to do this effectively. I would like to see hospitalists everywhere take a stronger position on this, and SHM and hospitalists lead the medical community. Less than 2 years ago, SHM launched a patient experience committee to start doing just that, and I have to say I was also very gratified to hear some of these same themes emerge at the Journal's annual meeting just yesterday. Third, as Bob mentioned, we have to move more assertively to understand our role in the era of risk. While in many sense, hospitalists have been managing risk either directly or indirectly for years or if not decades, length of stay, readmission rates, et cetera, the payment and models of care, episodes, bundles, MIPS, ACOs, are now evolving extremely quickly, and quite frankly, hospitals, health systems, payers, doctors, and professional organizations are all rapidly looking to stake out their place in that world. We have to do the same and to figure out who our partners are going to be. Many of you may already be in physician or hospital organizations that are implementing bundled payments or ACOs, but hospitalists need a clearer message about how what we do mitigates risk and where specifically we add value, and how to ensure that hospitalists and hospital medicine have a seat at the table and are not serving others at it. In the coming year, we will start to do that. And finally, I believe, as hard as this is, in the coming years, in the long term, we need to clarify our position regarding specialty training and our training programs. We already have many of the key components that we identify with as a specialty, most recently, of course, the Medicare Billing Code. And while this discussion can certainly get difficult and contentious and political, quite frankly, when we look at the gap between what we have to do to be clinically effective, palliative care, ICU care, consultative management, transitional care, post-acute care, QI, leadership, procedural training, communication skills. When we look at what we have to do to be clinically effective and what our current training programs in family medicine, internal medicine, and pediatrics provide for us, that gap to me only appears to be increasing. Our work environments are expecting and asking and demanding that our skills be ever broader, while the acuity of the environment and the stress of the hospital environment continues to rise. But I'm not so sure that our training is continuing to reflect these needs. SHM has and will continue to step up with curricula to fill those gaps. But increasingly, I think we have to question what is the best way to train physicians for the roles of providers in the acute care setting, I think we have to increasingly ask the question how best to train our advanced practice providers and other members of that team, and ask if the current model is the best one or the sustainable one. So, I am truly privileged and excited and honored to be here today. As I said before, my ask of each of you is to look at yourselves and how the practice as a hospitalist provides you and opens the door to grow personally and professionally, how we can make our system and specialty better, and to look to SHM and to ask of SHM that we help you, support you, and provide resources for you to walk your path. So before I dismiss the plenary, and I'm happy to say we're a few minutes ahead of schedule, I do want to reiterate a few don't forget items. Don't forget the HM16 app. It's really fantastic to guide you all through the rest of the meeting. Please do stop by the exhibit hall before sessions. Visit Hall B next door today to check out the winning RIV posters. And of course, as Larry said, please be tweeterific at #HospMed16. You've all been sitting very patiently this morning. This is the Year of the Hospitalist. Thank you for making this the biggest and best annual meeting ever. Thanks. Have a great day at the meeting today and tomorrow. Thank you very much.